Hello all. Today we will focus on the basics of the endocrine system. First, let's read the question. A 43-year-old female comes to the clinic because of recently noted symptoms of headache, persistent fatigue, menstrual irregularities, and weight gain.
She reports a history of persistently low mood and sleep disturbance for 3 months, for which she was prescribed fluoxetine 40 mg. Vital signs show a blood pressure of 145 by 90 mm mercury. Physical examination shows a rounded face with acne and stretch marks in the upper limb. Serum studies show increased cortisol and ACTH levels. An MRI of the cell touch reveals a pituitary adenoma causing hypersecretion of ACTH.
Which of the following structures is the embryonic origin of the involved part of the pituitary?
A. Neuroectoderm. B. Neural crest cells. C. Mesoderm. D. Rathke's pouch. E. Pharyngeal arches.
Let's dive into the development and histologic features of the endocrine glands. First, starting from the top, we have the pituitary gland. The pituitary gland is divided into the anterior pituitary and the posterior pituitary. The anterior pituitary, or the adenohypophysis, is derived from the oral ectoderm, also called the Rathke's pouch, which is an outpouching of the roof of the mouth or the stomodium. Posterior pituitary or neurohypophysis arises from the neuroectoderm of the diencephalon. Thyroid gland develops from the endoderm of the pharyngeal floor, specifically from an outpouching called the thyroglossal duct, which eventually descends to its final position in the neck. Foramen cecum is a normal remnant of the thyroglossal duct, which is found at the base of the tongue. The parathyroid glands are 4 in number and divided into superior and inferior glands. The superior glands are derived from the 4th pharyngeal pouch endoderm, and the inferior glands develop from the 3rd pharyngeal pouch endoderm. Pancreas, or more concisely, the endocrine pancreas, is formed from 2 distinct endodermal outgrowths from the foregut, the ventral and dorsal pancreatic buds. The adrenal gland is divided into 2 parts, the cortex and the inner medulla. Cortex originates from the mesoderm of the intermediate mesoderm, whereas the medulla develops from the neural crest cells, which are derived from the ectoderm. Some important clinicals relevant to embryology include the thyroglossal duct cyst, which is a fluid-filled sac located in the anterior midline of the neck and moves with swallowing. It originates from the remnants of the thyroglossal duct, often found near the hyoid bone. As you can see from the diagram on the right, that the foramen cecum begins at the root of the tongue and follows a course anterior to the hyoid bone in front of the cartilages and ascends to join the thyroid gland. Another clinical is a lingual thyroid, which is located in the base of the tongue. Now we begin with histology. As we go through the histology of each gland, I will share with you images that I personally drew with my eosinophil and basophil pencils, a time I think most medical students can relate to. Starting with the pituitary gland, this has 2 to 3 parts. The anterior pituitary, or the adenohypophysis, is composed of acidophils and basophils. The acidophils include somatotrophs, lactotrophs that secrete growth hormone and prolactin. The basophils include corticotrophs, gonadotrophs that secrete FSH, LH, ACTH, TSH, and POMC. You can remember this by the mnemonic FLAT. Posterior pituitary or neurohypophysis contains neurosecretory axons from the hypothalamus, which stores the oxytocin produced by the paraventricular nucleus and vasopressin produced by the supraoptic nucleus in herring bodies. Please remember that the posterior pituitary only stores these hormones and does not produce them. The production is mainly by the hypothalamus. Intermediate lobe of the pituitary gland secretes melanotropin. Pro-opiomelanocortin undergoes cleavage to ACTH, beta-endorphin, and MSH. Here is the image I drew that summarizes the histologic features of the pituitary in one shot. Next, the thyroid gland has 2 follicles lined by simple cuboidal epithelium. It has 2 types of cells, follicular cells and parafollicular cells. The follicular cells line the follicles and produce thyroid hormones T3 and T4, whereas the parafollicular cells, or C cells, are scattered between the follicles and produce calcitonin. These are important in reference to a carcinoma called medullary thyroid carcinoma, which we will be studying later on. Parathyroid glands have 2 kinds of cells, namely chief cells and oxyphil cells. Here is the diagram depicting the thyroid gland and the parathyroid gland lying adjacent to one another. Endocrine pancreas is especially important since it is a vital gland in producing regulatory hormones. Cellular impairment can lead to conditions like diabetes mellitus. Pancreas harbors islets of Langerhans, which contain alpha cells, beta cells, delta cells, and PP cells. The alpha cells are located peripherally in the islet and secrete glucagon, whereas the beta cells are central and secrete insulin. Delta cells are interspersed and secrete somatostatin. PP cells secrete pancreatic polypeptide. Moving on to the adrenal gland, we know that the adrenal gland is composed of two parts, the outer cortex and the inner medulla. The outer cortex is divided into three zones, which you can remember by the mnemonic GFR. G stands for zona glomerulosa, where the cells are arranged in small clusters. You can visualize this with the help of the diagram given on the right. At the top is the zona glomerulosa, which secretes aldosterone, which is a mineralocorticoid. Next is the zona fasciculata, in which the cells are arranged in long cords, and this forms a major chunk of the cortex. This secretes cortisol, which is a glucocorticoid. Next, zona reticularis has cells arranged in a network and secretes DHEA, which is a weak androgen. The adrenal medulla contains chromaffin cells that secrete epinephrine and norepinephrine and has a rich vascular network. Here is a full view of the adrenal gland histology. This flowchart shows the key points you need to memorize. Let's look into the question. A 43-year-old female came to the clinic because she was suffering from persistent fatigue, weight gain, menstrual irregularities. Her blood pressure is on the higher side. On physical examination, she has a rounded face with acne and stretch marks. Serum studies show raised cortisol levels and ACTH levels, and an MRI shows a pituitary adenoma in the sella turcica, which is causing the hypersecretion of ACTH. Now, this clinical picture is consistent with Cushing's disease. Which of the following structures is the embryonic origin of the involved part of the pituitary? Irrespective of the clinical condition, we know that the ACTH is produced by the anterior pituitary gland. Since that is involved in the production of ACTH, we know that that originates from the Rathke's pouch. So the best option is D. Feel free to go over the answer explanations as they are helpful in learning further information even as you are solving various question banks. The key takeaway is the origin of the anterior pituitary, which is the Rathke's pouch or oral ectoderm. That's our motto, simple yet profound. It's the way to go. You can always use the comments or email to convey your suggestions. I will be happy to answer any queries as well. Stay tuned for more and don't forget to hit subscribe.